Okay, anyways, there's something wrong. I don't know what's wrong with me, but there's something wrong with me. And it says in the paperwork, let's see. It says for the first CT scan when I was in the hospital, it says impression, possible early acute appendicitis involving the distal appendix. Recommend clinical correlation. If the clinical presentation is equivocal, consider a short-term follow-up CT scan to reassess the appendix. And then it says findings which could be due to mild mesenteric adenitis, which is swelling of the lymph nodes or inflammation of the lymph nodes. Then it says otherwise no evidence of significant acute process. Borderline splenic enlargement, small cystic lesion in the right ovary. And that's it. And on the front page of it, it says final report, and the doctor that told me that it's all psychosomatic, that I'm basically making myself sick, is the one that signed it. So he signed it knowing that it says on there that I have might have acute appendicitis. So I don't know if he still thinks I have it or what, because I don't know, he's crazy. I did not like the doctor, so. But, and then on the second CT scan, it says, let's see, where did I put that? Oh, there it is. It says, at first it said, the appendix isn't clearly visualized to show no evidence of infiltrate change. There are several sub-centimeter mesenteric lymph nodes around the terminal ileum extended from the mesentery in the pelvis on one sees somewhat mesentery root, I totally skipped the sentence. The terminal ileum appears unremarkable. In the pelvis, one sees somewhat tilted uterus toward the right, and the right and left ovaries in place with the unilocular ovarian cyst on the right side, which measures 1.5 by 1.7 centimeters in size. Impression: several scattered mesenteric lymph nodes, the cause of which is to be determined, for which follow-up study is recommended with clinical correlation. Benign appearing right ovarian cyst. The appendix is visualized appears unremarkable, which makes no effing sense because it says right here that the appendix isn't clearly visualized to show no evidence of infiltrate change, which makes no sense. And then it says this is an addendum report at the top because I got this from the radiology place. I got it straight from the radiology place, so they did the addendum to it. And then it says, in the body of reports about the appendix, which should be corrected into the appendix is clearly visualized, and no evidence of inflammatory changes, such as acute appendicitis. How do you mess that up? Like, how do you mess up writing that? That makes no effing sense. The appendix measures approximately 6.8 millimeters in AP diameter with no evidence of enhancing appendix with contrast and no periappendiceal fat strandings. The appendix is along with the tip being along the midline at the level lumbar sacral junction posteriorly in abdominal cavity. No previous exam is available for comparison at the time of this reading. And yes, there is a previous exam available because I went to the hospital. They should have sent the CT scan from the hospital to the radiologist there. I don't know why they didn't do that, but and then recently, just to let you guys know, yesterday I got a CT scan on my head, my brain, because there's something causing the tremors, and I want to know what. I will find out if there's something causing the tremors tomorrow. In my brain. And I keep getting really bad headaches for some reason. And let's see. Like I said in the previous video, I keep having low-grade fevers. The highest one was 100.5. Lowest one was 99.2. Actually, no. Now it's been 99.9. Or 99.0, sorry. And, yeah. So, and I have a doctor's appointment to get my test results tomorrow, like I said, so, on the CT scan of my brain. It's really surprising how fast they send the test results to my doctor, because I just got it yesterday, so, and they got the test results the same day, so it's kind of like, do you even take the time to look at the thing, or what? Like, maybe it's like a really shitty place, but it says on the door that it's recommended by the Arizona magazine or something like that. But, anyways, if you have lupus, try and give me some support here, because I'm really getting sick of being told that I'm having that it's psychosomatic, that I'm effing crazy, that I'm basically crazy, and I'm making myself sick. My neighbor says that I'm making myself sick, and the firefighters that had come here when I was having severe symptoms won't take me to the hospital. They've denied taking me to the hospital 3 times. And I'm just not going to call them anymore because I have another place I can call for an ambulance. And they just bill my insurance. I don't have to go through the fire department to get to the hospital. So, but they, one of the firefighters actually had the gall to tell me that it's my anxiety causing me to be sick. And that really pissed me off. Because it's not. Granted, I do have borderline personality disorder, bipolar disorder, PTSD, depressive disorder, and I think anxiety disorder, but that doesn't mean anything. I'm on medications for that. I'm on all kinds of psych meds. And I'm also on a psych med, not a psych med, but I'm on Benadryl for my side effects. So, if you're going to say that my side effect of tremors, or not my side effect of tremors, but my tremors are a side effect of my medication, then you can just get out of here. Because it's not my medication. I've talked to my doctor about it, and he says it's not my medication. Because I take Benadryl for side effects, specifically. And my tremors have gotten worse since I've been sick. So, there's something going on. And I keep having pain in my joints. Lately, it's really been in my fingers a lot. Like, in the joints of my fingers. And it hurts to, like, move them. And it's really hard to get to sleep because I keep having tremors. Because I keep shaking and stuff. And, like, twitching when I'm laying in bed. But I gotta go.